Welcome to Mom Hacks and Tips, the podcast that brings you essential advice for your pregnancy journey. Today, we're tackling a sensitive topic that can cause a lot of worry, spotting during pregnancy. And here to provide some clarity is our expert guest, Dr. Evelyn Reed.
Thank you for having me, Daniel. It's a crucial topic, and my goal is to help your listeners understand what's happening and when to seek care.
To start, what is spotting, and how is it different from heavier bleeding?
Spotting is very light bleeding, often just a few drops of pink, red, or brown blood on your underwear or toilet paper, not enough to soak a pad. Bleeding is a heavier flow that would require a liner or pad. While any bleeding in pregnancy should be evaluated, spotting is much more common and often benign.
Let's go trimester by trimester. What are the common causes of spotting in the first trimester?
In the first trimester, spotting can be caused by implantation bleeding, which happens when the embryo attaches to the uterine wall. It can also result from hormonal changes or increased blood flow to the cervix, which can cause it to bleed easily after intercourse or a pelvic exam. However, because spotting can also be a sign of a complication, like an ectopic pregnancy, it's vital to consult your doctor for any bleeding.
What about spotting in the second trimester?
Spotting is less common in the second trimester, but it can still happen. It may be due to irritation of the cervix or the presence of a cervical polyp, which is usually harmless. In some cases, it can be a sign of a more serious issue, like placenta previa, where the placenta is covering the cervix. Again, any spotting should be reported to your provider.
And what are the causes and concerns related to spotting in the third trimester?
In the late third trimester, spotting mixed with mucus can be the bloody show, which is a sign that your body is preparing for labor. However, spotting can also indicate a serious placental problem, like placental abruption. Because of this, any spotting or bleeding in the third trimester requires immediate medical attention.
Could you summarize the key warning signs that should prompt a pregnant woman to seek immediate medical care?
Absolutely. Seek immediate care if you experience bleeding that is as heavy as a menstrual period, if you're passing clots, or if the bleeding is accompanied by severe abdominal or shoulder pain, intense cramping, dizziness, or a fever.
What are some practical tips for expectant mothers who experience spotting?
The first and most important tip is to call your doctor or midwife to let them know what's happening. They will likely advise you to rest, avoid strenuous activity and intercourse, and stay well hydrated. It's also helpful to monitor the color and amount of spotting so you can give your provider a clear report.
Speaking of monitoring, keeping track of symptoms is so much easier when you have the right tools. That's why I want to tell you about mymiracleplan.online. It's packed with free resources, including a daily tracker to log symptoms for your doctor, a pregnancy timeline, and expert articles. Plus, you can plan for your baby with the AI name generator and new baby plan, and get support after birth with postpartum care guides. It's your one-stop shop for a confident pregnancy. Dr. Reed, thank you so much for breaking down this topic with such clarity and reassurance.
It was my pleasure. The key takeaway is not to panic, but to always communicate with your healthcare provider. They are your partner in this journey.
Wonderful advice. To all our listeners, thank you for tuning in to Mom Hacks and Tips. Be sure to subscribe for more valuable tips, and we'll see you next time.